you can see, if we go to the next slide, you can see the principles that guide our work here. And I know you won't have time to read these today, but you will get these slides as a follow-up, and you'll be able to take a look at exactly how we sort of focus in on our policy work. But many of these priorities, or many of these principles that we follow, are about removing barriers to basic needs, to safety net programs, to public assistance, and making sure that people have a level playing field. These are the campaign members, the Thrive Kentucky members. And if you're interested in learning more about any of our organizations, you can click these hyperlinks and go to our websites. And go to the next slide. We always like to thank our sponsors for supporting this work. It makes it possible for us to provide these webinars as well as our road shows, which I'll talk about in a minute, free for everyone, and to provide CEUs for social workers and for community health workers. And if you are interested in becoming a sponsor, we accept new sponsors year round. So we have some information at the bottom of the screen here with our sponsorship flyer, more information about what we do and who we reach. And then you can contact Kelly Talby on our team to learn more. Let's go to the next slide. So I mentioned our road shows. We go in person between the end of the legislative session and the end of the year, essentially, the holidays. We hit the road, and every month we go to a different community around Kentucky and really get a better feel for all of the ways that policies are or are not working in those communities, and what some of the highest priorities and needs are. And we just really love to, visit different communities, interact with community professionals who are on the ground doing this work every day, helping their neighbors to navigate the healthcare system, public assistance programs, housing, and to really get those resources into their hands. So in addition to talking about all of the topics that we cover on calls like this, we also do advocacy training. And I'm sure that many of you have joined us for one of these. Hopefully you'll be able to join us this year in a community close to yours. And please share this information with your colleagues if you find it helpful. At the end of the year, we will be doing a virtual form as well. We can go to the next slide. And this is our agenda for today. So I looked back, and I think our last webinar was in March. A lot has happened since March. So we are going to be giving you a federal update really focused on the Reconciliation Bill, the One Big Beautiful Bill Act, and then talking about what's going on during the interim here in the state legislature, and a lot more. And we'll be covering those with all of our Thrive Kentucky partners who are joining us today. We can go to the next slide, just a little housekeeping. We have gotten a few questions through registration, and we're going to try to address some of these as we go. If you have other questions, be sure to put them in the chat. We do like to just see your questions, your comments, letting us know what's going on in your communities. And we try to stop and kind of address those throughout, or just respond in the chat. If we don't get to every question during the next 90 minutes, we will provide a follow-up response in email. So I mentioned CEUs already. We do have an evaluation that you have to complete after this webinar if you want to have CEUs for participating. We want everyone, of course, to give us their feedback. So everyone is welcome and encouraged to take that evaluation. But if you need CEUs, you need to complete that evaluation. And you'll get a link to it in a follow-up email, along with the slides, along with the recording of today's video, and any additional resources that we share. And with that, I'm going to go ahead and get us started with the federal update. Let's go to the next slide. So many of you, I think, are aware, very few people who tune into these calls want to be at this point, that Congress has been debating a big reconciliation package. So this is a budget reconciliation, but it's been called the One Big Beautiful Bill Act. And it really combines all of President Trump's priorities in terms of extending tax cuts that he, originally started in 2017, and some additional spending that's a priority of the president's administration, in addition to major cuts to only help pay for it. Unfortunately, all of these deep, deep cuts to basic needs, to our safety net, wouldn't even come close to covering what will add to our federal deficit, cumulatively $3 trillion. But this is one way that they are shaving off a little bit and trying to really shift federal funds, shift the cost for some of these very important programs to states. And that really is what this bill is. When you get right down to it, it's cost shifting to the state and to Kentuckians who can least afford it. So the Senate just released new language yesterday from the Finance Committee related to cuts to Medicaid and to many of the marketplace changes, what we call our state-based marketplace connect. Last week, we got some additional Senate language around SNAP. We've got their changes to child tax credits, to the earned income tax credit. I should have spelled that out, the EITC. And what we know is that the Senate version of this bill is even more harmful than the House version. Kentuckians stand to lose really, really big. And we are estimating that probably on the low end, 200,000 Kentuckians would lose their Medicaid coverage. We would see lower provider rates with the Senate version because they are reducing the provider tax and these what they call directed payments that help to increase provider rates. They're also, we are seeing estimates that we would be losing anywhere between 12 and 24,000 jobs because fewer providers would be able to continue to practice and to cover their bills. And we would see people, just for the lack of federal funding coming into Kentucky, losing work because this has been such an economic boon for Kentucky. We're still incredibly concerned about the work reporting requirements and the exemption paperwork, the double redetermination periods, mandatory copays for certain members. And all of this will impact not only those individuals who are enrolled in Medicaid, but every single Kentuckian who relies on having a hospital in their community, who would have to pay higher premiums perhaps to continue to kind of offset those losses in federal funding. Marketplace coverage too would take a huge, huge hit. We would see the cost of these plans increasing so much that 47,000 Kentuckians are estimated to lose their marketplace coverage completely, with 50,000 probably paying much, much more. And then as far as SNAP goes, we could see 50,000 Kentuckians losing their benefits. We would see a huge cost shift to the state, anywhere from 5 to 15% of what is currently covered by the feds, coming to the state. And that could put just a huge strain on our state budget. We are taking, Kentucky legislators are taking our income tax to zero. We're having less and less revenue every year to fill in these gaps. And so even if, your biggest concern is another area of the safety net, having to fill in for SNAP to keep that benefit could really threaten all sorts of different parts of our state budget. And then the child tax credit would leave 308,000 low-income families out of receiving the full credit. EITC, that earned income tax credit, would create more paperwork, a pre-certification process for 262,000 working families in Kentucky. All of these things would be incredibly harmful to Kentuckians who are just trying to make ends meet. We can go to the next slide. So I mentioned our hospitals. There was a new analysis looking at, exactly how many hospitals would be at risk of closure because of these cuts in federal funding. Kentucky has the highest number of hospitals, 35 in total, that are at risk of closure. And the analysis really took a look at two types of financial criteria. Hospitals that have 10% Medicaid payer mix that were in the top 10%, excuse me, of Medicaid payer mix, and then hospitals that had experienced 3 years of consecutive negative total margin. So that's how these hospitals were identified. You can see them here by congressional district. And I also want to, just for context, say how disproportionate this is. Kentucky has 2% of the population, nationwide, and this would actually, we would be seeing 10% of the hospital closures in Kentucky. So for our state, we would have the highest risk. Let's go to the next slide. This is a fantastic map that Dustin just created, hot off the presses, and he will be releasing a short piece that goes along with this map later today. But you can see where these hospitals are located in Kentucky. Of course, it's concentrated more in Eastern Kentucky, but we were surprised to see how many were in Central Kentucky. We can go to the next slide. The other thing to note about this, we often think, well, people with Medicaid would lose coverage, or, people with SNAP would lose their SNAP benefits, but most households in Kentucky would lose resources. The vast majority would lose resources and not gain cumulative, all in between the One Big Beautiful Bill Act and the tariffs that are, affecting our economy now. So this graph shows both the tariffs in blue and the One Big Beautiful Bill Act in red. And you can see that the lowest income households lose the most. The highest, of course, gain the most. But even so, every household in Kentucky with an income of $55,000 or less would be worse off. And we would see that this combination would really be impacting the bottom 80% of US households. Let's go to the next slide. And as far as the timeline goes, I don't put much credit in, or I want to give this much credit. I don't think that this is going to necessarily be the real timeline that we're operating under. It's just the timeline that we've been given. Last week, of course, we got some of the committee language. This week, just yesterday, we got more. And this is going to be a short week for Congress because Juneteenth is a holiday. The week of June 23rd, next week, we've been told that they want to bring it to the floor for a vote. There's a lot that has to happen procedurally before then. And we think because there are such significant differences here, and there are some disagreements still within Senate Republicans between, the factions that don't want to see that big increase to the deficit, and then those that want to protect programs like Medicaid and SNAP. We're really not sure if if they're gonna be able to hold to their timeline. The week of June 30th, there is possibly, they're talking about a suspension of recess to continue working on this and get something passed before the July 4th holiday. But I think bottom line, regardless of what the timeline is, keep it up. This is working. There was new polling. We get lots of polling, but new polling from the Kaiser Family Foundation just this morning. I didn't make a slide on it because it was in my inbox literally like 20, 30 minutes ago. But showing just how unpopular the One Big Beautiful Bill Act is. Across the aisle, both parties, Democrats, independents, Republicans, and that even the individuals who like the idea of work reporting requirements, for instance, or some of these other changes, once you start talking about the paperwork, once you start talking about their local hospital being really strained and potentially closing, or increased premiums, or any of the real consequences of the bill, people immediately understand that this is not a good thing and their support tanks. So all of that to say, keep it up. It is working. We have slowed this down considerably, and there is still no kind of agreed upon package here by any means. I think it just got much, much further apart, to be quite honest. Let's go to the next slide. And this is my final. always want to just share with you so you have it at your fingertips, contact information for your members of Congress. I know you've all called. Please call again. Please get your networks to call. We've linked here 2 toolkits. One is from the Center on Budget and Policy Priorities. If you want any sort of materials that are beyond Medicaid, I would take a look at what they have. For Medicaid, use our Kentucky Medicaid Defense Toolkit. We've gotten Medicaid data specifically and population data specifically for Kentucky. So we would really love for you to use those tools and share them. And with that, I believe, oh, and one more slide, sorry. I tricked you. The Kentucky Medicaid Defense Coalition. We're having calls weekly at this point because of how quickly things are changing with the bill. Tomorrow at 2 p.m. Eastern, we'll have our next call. We'll be talking more in depth about some of these changes to Medicaid Marketplace and Medicare coverage, what that budget reconciliation process looks like, what the procedural steps that need to be taken. We're also going to discuss who is really considered able-bodied? What does that definition mean? And what Kentuckians are in that category and subject to work requirements? And then we'll dig into the rural hospital closures as well, or the risk of rural hospital closures. So there's a link to register. All right, thank you. And with that, I'm going to turn it over to Dr. Sheila Schuster.
Thank you, Emily, and good morning, everyone. Let's go to the first slide, Alex, please. So right now, the interim session here in Kentucky is happening. You all may think that when they adjourn what they call sine die without another day in March after the 2025 session that we're all through in Frankfurt, but actually the interim session is a great time for you to be in touch with your legislators. And just a reminder that the legislators that are in office now will also be in office when the 2026 legislative session starts in early January. So just a reminder that the interim session, no legislation can be passed, but they take their time to study issues in greater depth. They go back and look at bills that did not pass in the previous session, and they hear issues that are likely to be heard in the next session. It's a great time to present an idea, say, to an education committee, because you have both House and Senate members meeting together. So typically when you present a bill, you have to go over to the House Education Committee and work it through the process and then go over to the Senate Education Committee. But during the interim, those House and Senate committees meet together. So it's a really great opportunity to hear what they're thinking about in, say, in education or health services or family and children, or in the Appropriations and Revenue Committee. We also know that in the last couple of sessions, they've appointed special committees or task forces, and those have just been appointed. So each of those will study a single topic in depth and may have recommendations probably in the 2026 session. So Alex, let's go to the next slide and we can look at those interim task force meetings. Let me point out that 2 of them are continuation task forces from the 2024 interim. That's the Artificial Intelligence Task Force, and it is co-chaired by Senator Amanda Mays Bledsoe from Lexington and Representative Josh Bray. Also, the Kentucky Housing Task Force, and it's chaired this time by Senator Robbie Mills and Representative Susan Whitten. And I'm sure when Adrienne gives her housing update, she'll talk about that task force. A new task force is one on air mobility and aviation economic development, co-chaired by Senator Brandon Storm and Representative Stephanie Dietz. There's a very interesting one on disaster prevention and resiliency task force, and given the natural disasters that we've had here in Kentucky, I think their work will be very important. That's Senator Robin Webb and Representative Chris Freeland. And then taking a page from the federal Congress and President Trump, there's a Make America Healthy Again task force, and it is co-chaired by Senator Shelley Funke Fromeyer and Representative Matt Lockett. So most of these task forces will be meeting once a month, June through November. Next, please, Alex. Not typically known as an interim task force, but there is a new, very important Medicaid oversight and advisory board that's been created. We're calling it the MOAB. Some of you that follow legislation may remember that we used to have a committee called the Medicaid Oversight and Advisory Committee, or the MOAC. Well, this is a board, and it was hatched in House Bill 695. And it will make significant changes to the way that the Kentucky Medicaid program is administered by bringing the legislature much more into the picture. It establishes this MOAB to meet at least 6 times a year. And actually, it's going to be meeting much more than that. So the members are 5 Senate and 5 House members, and they include the chairs of Health Services and Family and Children's, and some other senators, Republicans, and House members, Republicans. And then there's 1 Democratic senator and 1 Democratic Republican that have been, representative that have been named to it. There are 11 non-legislative, non-voting members, including the Medicaid Commissioner, the chair of the Medicaid Advisory Council, which happens to be me, the Kentucky Budget Director, the Kentucky Auditor, a representative from the Managed Care Organization Association, the director of the Rural Health Center in Hazard, and 2 persons appointed by the Senate President and 2 by the House Speaker, both of whom have to have Medicaid experience. There are also ex officio non-voting legislators who are the chairs of the Senate, House, A&R committees. So it's heavily made up of legislators, as you can see, and the voting power is strictly with the legislators. Those of us who are non-legislative, non-voting members hope to bring our perspective and experience with Medicaid to the table. Next, please, Alex. So here are some of the duties and responsibilities and powers, actually, that MOAB will have. They can review any contract that Medicaid has with any entity. They can set the format for all reports requested and submitted. They can request the auditor to conduct an audit of any aspect. Remember, the auditor is serving on the MOAB. They can recommend changes to state law regulations affecting Medicaid, and they shall also review changes in federal law and analyze impacts. Emily just did a great job of talking about what might be coming down from the feds. And whatever version of the one big beautiful bill, which some of us think is not so beautiful, whatever version of that passes is going to have significant budgetary impacts on Medicaid. So that will certainly be something that the MOAB will be looking at and discussing. And then they've set kind of a rotating every 5 years review. And the first year in 2026 will be to review the administrative costs. In 2027, they'll conduct a program evaluation of the Medicaid program. In 2028, they will conduct an actuarial study. And then finally, in 29, they'll evaluate the overall health of the Medicaid population. I really wish we would start there because I think we need to have a baseline. Would be really helpful to have started with the evaluation of the health of the Medicaid population and then have the MOAB start working and come back 5 years later and look again. Shall publish an annual report of its findings, will set an annual research agenda and designate entities to carry it out. And the Legislative Research Commission is responsible for personnel and budget. In other words, the legislature is going to fund this themselves, and they will control all of the staff that does the work of the MOAB. Next, please. So a couple more items about the interim calendar. You have to check the interim calendar at least every week because they change it about every week. And that's the link to get the interim calendar. And it's pages long because they have a page for every month starting in June and going through November. But here's the schedule for the MOAB meetings. They're set for a late Wednesday of each month, June through November at 3 o'clock in the Capitol Annex. And those dates are June 25th, July 30th, August 27th, September 24th, October 22nd, and November 19th. As is true of all of the interim and regular session committees. You can find all the meeting materials online. And just a reminder that the LRC has a live stream, a YouTube that will record the meetings and is available afterwards. Some of the live coverage will be covered on Kentucky Educational Television. And I think it's quite possible that they will cover the Moab meetings on KET, but you can check either there or at on the LRC YouTube channel. Next, please. And just a final reminder that all of this is important. So to remind you that you have two main ways to participate in our democracy. One is your voice to speak out, and one is your vote. So 2025 is not an election year in Kentucky, although we're already hearing lots of talk about who's going to run to replace Mitch McConnell in the Senate, and there's going to be more and more of those kinds of early election, but that election is actually in 2026. So since it's not an election year, your voice is much more important this year. And remember that you can influence others to vote and to speak out. You can certainly encourage others to vote. And there was a good question. Thank you, Bev. Yes, the technical advisory committees were not touched in any of this. The CMS rulings around the MAC and the BAC did not affect the tax. So those of you who follow the technical advisory committees, they still are in existence. And I think that's my last slide. Yes, I'll turn it over to my colleague, Dustin Pugel. Thank you.
Thanks, Dr. Schuster. My name is Dustin Pugel. I'm the Policy Director at the Kentucky Center for Economic Policy. And another thing that's happening through the interim are budget review subcommittee meetings. These are groups of legislators from the House and the Senate that come together to review different aspects of how we spend the state's money and trying to formulate a plan heading toward next session, which is going to be a budget session. Kentucky passes a state budget once every 2 years. We are currently in the final, well, we're actually about to start the final year of our biennial budget. That means that we're going to need a new one here this coming session. So we want to talk a little bit about the budget, but then also kind of what some of the key issues surrounding our ability to meet the state's needs are at the moment. So if we go on to the next slide. I just want to start by saying that, Kentucky has been going through a fairly lengthy period of reducing our state income tax. Prior to 2022, the state income tax was our largest bucket of money. It was our fastest growing source of income, and it was a pretty steady source of income for the state. However, the General Assembly has made it a priority to cut that income tax. They created a formula for themselves that would allow what are called triggers. These would be sort of the moments when they would let themselves vote on a reduction in the income tax. And they've been doing that really for, I think, 3 of the last 4 years, starting with a reduction way back in 2018, actually, when we had what's called a graduated income tax, where the tax rate increased as people's incomes rose. They flattened that out, and since then they've been reducing at this sort of half percentage point at a time. While half a percentage point may not sound like a whole lot of money, that represents around $700 million when fully implemented. And at this point, we've reduced it 3 times, from 5% to 3.5%, which means we're going to receive around $2.1 billion less in revenue for our state than we would have otherwise. So let's move on to the next slide. I think it's important, much like the one big beautiful bill, the benefits for these income tax cuts are skewed. That is because, frankly, people with more money pay more income tax, as I think is reasonable, even when it's a flat rate. So when you reduce the income tax, the vast majority of the total benefit goes to the wealthy. So if you look at just the top fifth of earners in the state, the top 20% of earners, 65% of the value of that $700 million cut at a time goes to them. If you just look at the top 1%, so folks who are earning annually in wages $500,000 or more, we're talking about around 20% of the benefit. So it's a very significant windfall for top earners. For the bottom million Kentuckians, we're a state of 4.5 million. The bottom 1 million, there's actually no benefit whatsoever because they don't pay an income tax. We have a sort of essentially a tax credit that does not require them to pay an income tax. So they don't see any of the benefit from this. All right, let's move on to the next slide. So, we use that money though to pay for services throughout the state, right? When I was in undergrad and I had microeconomics 101, my professor ran into the room one day holding up a really thick document, and he said, "Budgets are a moral document. They're a statement about what we value." And that's still true today. If you look at the way we spend our money in this state, I think you can assume that we have some pretty decent values. We pay for P through 12 education, Medicaid. I'm going to come back to that in a minute. Criminal legal system, the post-secondary education system, other types of human services, and then if you throw everything else that we pay for as a state into that last bucket, it's around 12%. Kentucky spends about $16 billion of its own money every year, but we spend $55 billion total. So a lot of that is federal money, and I'm going to come back to that in a minute. But I think it's just important to point out that the actual money that we spend as a state from income taxes and other forms of income or other forms of revenue is really a portion of what we pay overall, but it's a significant portion, and it's the most flexible portion. It's the part of the budget where we can kind of make a lot of decisions about how we want to move forward. All right, let's move on to the next slide. To put what I was saying earlier about the income tax in perspective, if we just look at the potential of cutting another 0.5 percentage point, right? So going from 5% income tax to a 3% income tax, we're talking about somewhere around $2.7 billion. That is nearly as much as we spend on the Medicaid program as a state out of our general fund. It is far more than we spend on our base funding formula for K through 12 education as a state. It's more than, well, it's around double what we spend on post-secondary education, which is all of our community colleges and universities combined as a state. If you look at just the sort of large increase that the state invested in childcare this last session, it dwarfs that amount. So we're talking about a really significant amount of money. And when that is money that you're no longer bringing in as a state, it makes it much more difficult to meet the bills that you're required to meet in other parts of the budget. So I mentioned that $2.7 billion is nearly as much as we spend on Medicaid as a state. If we go to the next slide, I think it's important to remember that Medicaid is a pretty good deal for the state. The yellow bar down below is what the state pays if you adjust for inflation, and the blue bar is what the federal government pays. As you can see, the federal government picks up a large majority of the tab when it comes to our Medicaid program. You'll hear more about Medicaid later, but as everyone I think on this call knows, Medicaid covers around 1 in 3 Kentuckians, half of births, 70% of nursing home residents. It has a significant economic impact. So places like Eastern Kentucky, Medicaid spending represents about 13% of the total value of all goods and services produced in that region. So it's a really significant program in the state. It's also probably the program with the biggest target on its back. Not only is the federal government looking to make significant cuts to this program, potentially over 10%, there are also real concerns that have been expressed by legislators about the portion of the budget that Medicaid takes up. While Medicaid is not the largest sort of category of spending in the state, it is the single largest appropriation. And so there are a lot of ways in which this really critical program is causing appropriators both in Frankfurt and DC to grind their teeth, if you will. Now, I think it's also important to remember that it plays a really vital role, particularly for workers in the state. Medicaid covers hundreds of thousands of people who are on the job here in the state, And if you've heard stories in the past from the Medicaid Defense Coalition or other outlets, you'll know that there are a lot of people who got well enough to be on a job in order to continue to work, and that was only because of Medicaid. Yet the biggest cut to Medicaid in the congressional plan, as well as an attempt made by the legislature this past session, involves Medicaid work requirements, which primarily hit working Kentuckians because that's the majority of adults covered by Medicaid, or at least working age adults covered by Medicaid. So if we move on to the next slide, I just think it's really important to leave with the understanding that Medicaid is a massive support to workers. It really does contribute to their well-being. And if you look at this graph, the lighter blue line represents folks who are covered by Medicaid, but they're not working because of an illness or a disability. The dark blue line is the percent of Medicaid enrollees who are working. And that has increased, particularly after the expansion of Medicaid in 2014. That's really when this line took off. So it's a I think important thing to remember that these are folks who are contributing in the workforce. They're contributing to our state income. And if we make it more difficult for them to stay covered by adding paperwork barriers, it's going to be more difficult not only to afford the Medicaid program and to be able to support all the jobs that Medicaid supports. It's also going to be harder to support the workers who rely on this for their well-being. All right, that's it for me. I'm going to hand it over to Mr. Ogile.
That's me. So I'm about to toss a link into the chat that has to do with our Snap toolkit that you'll soon understand why I'm sharing that with y'all as we get into what's facing the feeding system across America right now. So please feel free to reference this either in meeting or out of meeting. It's a great tool that was devised by the Kentucky Food Action Network, of which I am a part. I work with Feeding Kentucky, and I'm here to talk to you about Sunbucks, Snap, and WIC. So let's dive into the state of hunger in Kentucky. This data shown before you right now is from Feeding America's Map the Meal Gap study, which traces hunger on a 2-year delay. So this is 2023 data, which gives us our first real glance at 2020 to 2023. How has hunger changed over the pandemic? What worked for America when the government was providing consistent support for food nutrition? And what did it look like when it was rolled back? And what we can clearly see is that the vast majority of Kentuckians are struggling with some degree of food insecurity, with over 753,000 lacking consistent access to nutrition, with 1 in 5 children being food insecure. We also have the second highest rate of hunger in the ages of 50 to 59, which we classify as just older adults, not senior citizens, of course. And then there are 4 counties in Kentucky that rank in the top nationally in food insecurity and poverty. So you can see Breathitt, Owsley, Knox, and McGuffin counties are ranked nationally, and obviously not in a way that we want to be known. And we are doing everything we can between our school nutrition programs, our food banks, state supports, doing everything we can to drive down food insecurity, but obviously now is not the time to move backwards against it. And as you've heard previously on this call, things like the Big Beautiful Bill will be a distinct step in the wrong direction. Next slide. So let's go through what is currently holding up the feeding ecosystem in Kentucky. First, you've got the Supplemental Nutrition Assistance Program, SNAP, formerly known as food stamps. You can see what your gross income needs to be in order to participate. For example, for a family of 4, you need to be making $62,000 a year. Dispelling some misinformation, non-citizen parents can apply for SNAP benefits for their citizen children, so you're not looking at non-citizens participating in the program, as has been a popular talking point, especially as the whole waste, fraud, and abuse discussion has evolved over the last few months. Women, Infants, and Children program. Contrary to popular belief, you don't necessarily have to fit into one of those 3 categories. You can be pregnant, breastfeeding, or a postpartum woman, or the caretaker of a child under the age of 6. So kinship does fall under WIC. And then its poverty level designation is slightly different than SNAP. It's 185% of the poverty level as opposed to 200%. The National School Lunch Program, That's also a well-known intervention that helps drive down hunger across the state, especially for the 1 in 5 kids facing food insecurity, with 130% of the poverty line being the gross income designation to participate. Now, you'll hear some schools use the categorical eligibility provision, CEP, and that will certify an entire school for free school meals based off of the number of students participating in programs like SNAP or Medicaid. So especially as you hear things like SNAP and Medicaid enrollment being driven down by congressional measures, it's going to be one swing of the axe that's going to fell multiple trees. So as Medicaid and SNAP enrollment for Kentucky plummets, so will also categorical eligibility. And as a result, you'll have the hungriest Kentucky children missing out on meals at school and at home. And inevitably, their classmates will also be missing out on those meals as entire schools are certified under this program. And then, of course, the Summer Electronic Benefits Transfer Program, also known as SunBucks. That's for households with school-age kids over the age of 6 participating in the National School Lunch Program and kids under 6 enrolled in SNAP. And it will make up for meals missed by students who qualify during summer when school is out, when they can't go to the cafeteria. It's a way for them to still eat and not go hungry for those 2-3 months. Next slide. So the long and short of it is that Kentucky cannot afford food insecurity. The House passed budget reconciliation will cut $300 billion from SNAP in 10 years, and that's going to be the largest cut in history. It will use a cost shift mechanism to reduce federal contribution, intentionally making the program harder to administer and participate in. So shunting any amount of federal cost back to the states, demanding that Frankfurt pay for part of SNAP, will not only get rid of the economic stimulus that SNAP is known to provide for states, but it's also going to make it really difficult for the folks in the General Assembly to justify adding another 200+ million into the budget to keep this program afloat. We don't know whether they will. We don't know if they don't, what that will look like, but we know that it's going to come at the cost of hungry Kentuckians. The budget cuts also freeze the Thrifty Food Plan, which is an adjustment for how much benefit SNAP users get based off of not just inflation, but for a healthy diet. So as we get into discussions of SNAP choice on what people can spend their money on, keep that in mind that they're getting rid of the provision or freezing the provision that allows SNAP users to have a healthy diet and scales their benefits accordingly. And it's a very real possibility that the cost shift could end SNAP for the entire state, especially if Kentucky cannot contribute the necessary dollars, there's every likelihood that the program will not exist in its current format if it continues to exist at all. So, next slide. As they justify the big beautiful bill, one of the main claimants that they make is that there's waste, fraud, and abuse, and that justifies any and all gutting of the program. But intentional fraud at SNAP is less than 1/4 of 1%. And the skimming that takes place in the program is oftentimes the users being the victims as opposed to being the perpetrators. And there was a temporary fix in the 2023 appropriations bill, but it has since ended, and it would allow for the replacement of benefits if someone were to lose their SNAP dollars. And we tried implementing a similar reimbursement program in a budget last December, but that was stripped away at the last second. And so any discussions around waste, fraud, and abuse are likely going to be chock full of disinformation that we need to dispel, especially in defense of the hungriest of Kentuckians. Next slide. Monthly SNAP participation in Kentucky has only risen over the last few years. There was a slight dip previously, but we are on track to increase as more and more people are food insecure. Total SNAP participants as of June of last year was 617,000, with the average household benefit being around $370. So clearly supplemental. A family of 4 cannot live on just $370 a month for groceries. It is a true supplement as opposed to just covering the entirety of the grocery bill or a trip to Kroger each month. Percent of Kentuckians participating in SNAP is around 13.7%, but bear in mind only 65% of eligible Kentuckians who could be participating in SNAP are. And that translates to about $1.2 billion spent in Kentucky on SNAP annually, and that is economic stimulus that we cannot afford to miss out on. Next slide. The long and short of it is this will be balancing the budget on the backs of hungry Kentucky children. They're going to lose their health care and meals at home in addition to the food at school. So circling back, remember that CEP certifies schools based off the percentage of students on Medicaid or SNAP. And when enrollment plummets because of this budget reconciliation, hungry students and their classmates will pay the price, and we'll see that in how mental health outcomes diminish, and how school achievement plummets, and in how just general life expectancy and healthcare outcomes reflect the moral document that Congress is setting out right now. Next slide. So circling back to how the Thrifty Food Plan was frozen under this or will be frozen under this legislation, there have been a lot of disingenuous attempts to improve the diet of SNAP users, with some Make America Healthy Again initiatives, including restrictions on what SNAP users can spend their money on, preventing them from buying anything from energy drinks to candy to what they deem as junk food. Bear in mind that is hundreds of thousands of barcodes that retailers will need to be responsible for gatekeeping. And more than likely, retailers will just stop accepting SNAP as a whole rather than a mom and pop shop in Appalachia trying to stay abreast of every new barcode that they need to prevent users in their small town from participating in. So it's going to make the program even harder to administer, which is by design. And this will impact revenue of small retailers and big retailers greatly, with some Appalachian, Eastern Kentucky mom and pop stores, up to 50% of the revenue comes from SNAP. So if they're not able to accept it anymore, not only is that going to affect those who can't buy from the grocery store that's within 30 minutes of them, but it's also going to affect the small businesses that are keeping those communities afloat. Nutrition incentives are far more effective use of time and resources, giving cash back, helping dollars stretch further when spent on healthier purchases. Plus, it's just a far more genuine attempt to actually improve the diet of the hungriest amongst us, especially when the freezing of the Thrifty Food Plan demonstrates a clear lack of commitment to healthy options for SNAP users. We need to focus on lack of restriction and instead put that effort and that energy into incentives. Next slide, please. And then Sunbucks, summer EBT, it provides grocery money during summer as addressed, provides in 2025, $40 per month per child, when previously it was $120 per student for the entire summer. And in 2026 onward, it will also be $40 per month per child. And summer EBT applications are open right now. Please make sure that you and anyone you know who could participate is not missing out on that valuable resource. Next slide. And of course, beyond staying informed on what everything is, what's happening in DC, please feel free to connect with Feeding Kentucky's resources map, food banks, emergency food assistance, senior feeding, school feeding, non-congregate sites, Sunbucks, SNAP connectors, WIC, what have you. I promise you we've got resources to connect you with, and I'm happy to answer any questions about that later on. But all is not lost. The feeding ecosystem is alive and well, and we need to make sure it stays that way. Thank you. I'm going to pass it off to my colleague Adrian to talk to you about housing.
Thanks, Jordan. Hi, everyone. Adrian Bush with the Homeless and Housing Coalition of Kentucky here in Frankfort. All right, so starting off, I think the name of the game over the past 6 months has been disruption in our federal housing assistance environment. So on the table, we've had lots of disruption from the Department of Government Efficiency, plans to unwind, dismantle FEMA after the hurricane season that is upon us. Different dismantlings of protections with fair housing, equal access, federal rules that are put into place to ensure that people have fair access to housing in communities of their choice. And then on the homeless assistance side, we've seen a lot of disruption in payment system for open and current grants, and then contracts. Next slide. All right. So with that, that's the current environment. And we are now entering what is known as appropriation season in Congress. So we've talked a lot about the budget reconciliation bill. But while that is occurring, there is a separate, smaller slice of the federal budget pie, if you will, known as non-defense discretionary funding. And that is where housing assistance, public housing, housing choice vouchers, homeless assistance, that is the section of the budget where all of that comes from. And what the White House has proposed to do is eliminate critical federal grants that actually help develop affordable housing, like the Home Investment Partnerships Program, the Community Development Block Grant Programming. They are proposing to zero those out. They are also proposing to block grant and then cut rental assistance, again, whether it's public housing or housing for the elderly or people with disabilities, all of our rental assistance by 43%, and then limit that assistance to 2 years. They are proposing to eliminate the Low-Income Home Energy Assistance Program, or LIHEAP. They are proposing to cut fair housing funding by $60 million nationwide, as well as homeless assistance by $532 million. Again, like this proposal for a state-based rental assistance program, they would block grant 2 states, and which would result in cuts and limit the participation to 2 years. And we know some folks, particularly people who have experienced chronic homelessness, need an intervention that is called permanent supportive housing, not 2-year supportive housing. And then lastly, they have proposed to eliminate the AmeriCorps program, which does a lot of good work across Kentucky and in other states. So next on the menu, both in the House and Senate, the appropriations committees and their subcommittees that have jurisdiction over different parts of the non-defense discretionary pie are meeting. The message has been communicated from the appropriators in leadership that they would like to stick pretty close to the president's proposal to cut HUD by 44 or 43%. So we'll see. But in the meantime, actual numbers and markups, while the committees have started meeting, no bill text has been released. So we will keep you apprised of any developments as this moves forward. But the other thing too that we could see are further cuts to our housing assistance through increased rents on the public housing side and work reporting requirements. Sound familiar? Next slide. Okay, great. So turning to the state, as Dr. Schuster mentioned, we have several task forces meeting during the interim. One that we have advocated for successfully and have been following pretty closely is the Kentucky Housing Task Force. And it met last year, and so they did have a final task force report that you can read if you're interested in it. Last year was really a level setting year, a lot of education for members about what our housing shortage is, which is about 200,000 homes across the state, why we have it, what that shortage produces in terms of outcomes, whether it's increased rents, homelessness, or the inability to purchase a home. So this year, we do have some new members. The leadership remains the same: Senator Mills from Henderson, Representative Whitten from Louisville, but we have members from Berea, Lebanon, Hazard, a little more diverse. Last year, it was pretty Louisville heavy. So the next meeting, which is actually the first meeting, is coming up on June 30th. You're welcome to come to Frankfort and attend the hearing or check out the live stream on either KET or YouTube. Next slide. All right, and the other task force that we're following pretty closely is the Disaster Prevention and Resiliency Task Force. And that Dr. Schuster also mentioned, this one is new. I think it is very timely given the amount and the devastation of disasters that we have had. Even this year, in April, well, in February, April, May, it's very timely. And so we are very interested to see if we can get some progress on disaster housing and what is needed kind of between the short and long-term recovery timeframes. Next slide. All right, so coming out of the 2025 session, there are a couple of laws that are coming into effect in about 10 days. And one is House Bill 160 that would require parity in local zoning requirements for manufactured housing. Another is Senate Bill 25, which kind of tinkers with industrial revenue bonds and allows for housing to be an eligible use under them for local governments. And Senate Bill 129 is a Louisville-specific law that will help housing nonprofits turn blighted and abandoned properties into affordable housing. Next slide. All right, so fundamentally, we know from the Homeless and Housing Coalition's perspective, our housing solutions need to be grounded in increasing the housing supply and affordability for extremely low-income Kentuckians, improving access to housing for people who are housing insecure, and creating statewide renter protections. So some of the bills that we have championed in 2025 and we look for in 2026 is House Bill 588 that would modernize and index the Affordable Housing Trust Fund fee structure. House Bill 534, which is record sealing for dismissed evictions and expungement for minors improperly listed in a filing. And lastly, Senate Bill 59, which is streamlining planning and zoning requirements for religious institutions to develop affordable housing. Next slide. All right, so I just wanted to, since this is a statewide call, bring up the ongoing response to spring storms. We have on the left the map from the May tornadoes of counties that were approved for individual assistance. And then on the right, basically a third of the state was approved for individual assistance for April flooding. At this time, public assistance, which is for local governments, has not been approved by the administration, but we do want to make sure that people know about the disaster assistance. The application portal is open. Deadline has not come up yet, so we want to share that information with folks. And with that, I believe I am not. Next steps. So I will put in the chat here in a minute. There is a sign-on letter around cuts at the federal government level that if you represent an organization, you can sign on to. And then on the state side, we're working on eviction record sealing advocacy. If you or someone you know or working with has faced barriers in securing housing due to prior evictions, let me know. And with that, I believe I can turn it back to Dr. Schuster. Thanks.
Thank you very much, Adrienne. So I'm back again, this time to talk about behavioral health. And by behavioral health, we mean mental health issues and addiction issues. And we kind of wrap those up to talk about behavioral health. And then we're going to talk about some of the Medicaid waivers that are out there for people with mental illness, substance use disorders, and other disabilities. Next slide, please, Alex. So just a reminder that all of the environmental things, if you will, that impact health also impact mental health. And so many of the things that we've talked about here, housing instability, poverty, food insecurity, low education, and so forth. So if you're dealing with folks that are having tremendous struggles just to maintain themselves and their families, you can bet that there's going to be both physical health and mental health sequelae from that. Next, please. So increasingly, I think Medicaid behavioral health services are under scrutiny. And one way that they will be under scrutiny starting on June 25th is through a process called prior authorizations, short PAs. And they're a mechanism that are imposed by insurers and MCOs to more tightly screen requests for services to be provided to a patient. this may have happened to you on the physical health side where you want to get referred to for surgery for a back problem, and your insurance company says, no, 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 no. Whether your doctor thinks you need to have PT or not, we're going to require you to have PT first, or we're going to require you to have certain x-rays or certain medications first. The insurers will say it's to improve quality, but there's nothing in the literature that suggests that prior authorizations improve quality. They are a cost-saving measure that are used by payers. So the prior authorizations were suspended by Medicaid at the beginning of the COVID pandemic, and those were the prior authorizations, excuse me, for behavioral health, which was a wonderful thing for them to do because, as we all know, that COVID pandemic and the isolation and the fear and anxiety and so forth wreaked tremendous havoc with people's mental health and with their recovery from addictions. And still, I think we're seeing the aftermath of that with adults, but especially with children and youth. So House Bill 695, which was passed in the 2025 session, and actually, as I referenced earlier, is the one that set up the Medicaid Oversight and Advisory Board, or MOAB, included in its directives that prior authorizations, like those that were in place in January 2020, should be reinstituted for behavioral health services when the bill becomes law, and that's June 25th of this month. It also says that DMS or Medicaid should monitor utilization rates and expenditures for all behavioral health services and report specifically on each service that is increased by 10% or more in that year. I would point out that there are no such requirements on PAs or on additional reporting for any of the physical health services. The behavioral health providers have requested that MCOs use consistent forms and language. When you are dealing with 5 different MCOs and they each have a different form, they each have different services that they require PAs for, and they each ask for you to respond in a different way, it is very, very time consuming and costly for the provider and their agency. One of the worst problems is that prior authorizations take providers away from direct client care because a staff member cannot answer the prior authorizations. It has to be responded to by the provider who was asking for the service to begin with. And it creates problems for the clients or patients because there is most often a delay in their getting the services. And as we know, both in mental health and in addictions, when people need help, they need help then. So we are very concerned about prior authorizations being reinstituted. Stay tuned and we'll let you know how this process unfolds. Next, please. On the good news side, after many years of advocacy, we are getting a waiver. It's actually a state plan amendment, a 1915I plan that was approved by CMS several months ago, and it specifically targets people with severe mental illness, and those are people that have schizophrenia, schizoaffective disorder, bipolar disorder, or major depression. So they are our neediest folks in terms of mental illness, and they have never had a waiver from proposed by Medicaid to give them additional services that are not available to in the typical Medicaid coverage. So they are going to be offered supported housing, which is not just a roof over their heads, but supports from people to remind them, for instance, to take their medications, to keep their appointments, and so forth. Supported employment opportunities. The families could that are giving care in their homes to their loved ones could get some respite services to give them a break. So these are exciting things, and we're very happy that Medicaid is working very hard to get this implemented, hopefully by the end of the summer. At least we have our fingers crossed. Another population not previously served with a Medicaid waiver are Kentuckians with mental illness or substance use disorders who are incarcerated. Typically, Medicaid is suspended when a member is in jail or prison, but they have been approved in this waiver called the reentry waiver to begin delivering Medicaid services, treatment, for instance, for their mental illness or substance use disorder 60 days before their release. And so they're getting hooked up with their managed care organization so that there's a smooth transition or a smooth handoff when they move into the community. What we've seen is that people get out of incarceration and kind of fall through the cracks and then either get in trouble with the law again or end up homeless or in other undesirable places. So we're excited to end a 5-year period of working on this waiver, and it's due to be implemented in October of 2025. Very exciting. Next, please. So they're also just a reminder that we have 6 Medicaid waivers. They're called the home and community-based waivers, or the 1915C waivers. With significant advocacy, funds were allocated in the 2024 budget session to create 1,925 new placements for the 2-year period. So it was a huge victory for families and consumers and advocates to speak up. Unfortunately, the waiting list, which was at that time 13,000, is now up over 15,000. So while we made a significant dent of 925 persons being put into active receiving Medicaid waiver services, we're now up over 15,000, which represents long waits to access waiver services. So we'll be back to the advocacy in the next budget session. Also want to remind you that CMS is requiring all states to establish a beneficiaries advisory council called the BAC, which I think is an exciting step forward. It's going to be made up entirely of past or present Medicaid members themselves or their parents, families, or caregivers. And after 2 years, members of the BAC, the Beneficiaries Advisory Council, will make up 25% of the Medicaid Advisory Council, which is largely made up of, although not exclusively, of providers and provider organizations, physicians, nurses, therapists, optometrists, and so forth. So there will be a whole lot more input from Medicaid recipients and their immediate supporters. The timeline for submitting your willingness to serve on the BAC has closed, and we are looking for an announcement of the new membership and formation of the BAC and those who will also serve on the MAC sometime in July. So again, stay tuned on that, but it's an exciting development. Next, please. So I want to point out a population that I think has really suffered, unfortunately, with some legislation. You remember in the 2023 session, Senate Bill 150 instituted a ban on all healthcare, all physical healthcare given to trans youth under the age of 18 or those who are questioning their sexual orientation. They also made significant changes to curriculum and policies at our public schools, making them, I think, less safe and supported environments for all LGBTQ students. Trans students are required to use separate bathroom facilities, and schools are less able to follow requests, even from parents, for use of a different name or pronoun for trans or questioning students. Just a reminder that the trans population is believed to be approximately 0.6%. That means it is less than 1% of the population, but they have been targeted by a number of legislative initiatives here in Kentucky. Last September, Governor Beshear signed an executive order which banned the negative practice of conversion therapy, which we actually think is better described as conversion torture, attempts using negative means to try to convince kids, because it's kids under the age of 18, that they are not gay. But House Bill 495 was passed in the last session, and it overturned the governor's executive order, and then went further and amended the bill to ban Medicaid payments for services provided to adults seeking gender affirming care and hormone therapy. Before, the impetus was for youth only, but this extended it to adults. And then Senate Bill 2, also in the 2025 session, specifically banned the delivery or the continuation of services for gender affirming care for any Kentuckians who were at that time incarcerated. And then finally, House Bill 4, which was the anti-DEI or anti-diversion, equity, and inclusion policies and teachings in our post-secondary institutions, will have a negative effect, certainly on LGBTQ issues and students, as well as those of students of color, and all kinds of ways in which people will no longer feel included and valued in the student body. Next slide, please. Oh, more sadness. In the last 4 years, 2019 to 2023, we lost nearly 4,000 Kentuckians to suicide. Most of them were white males, the highest numbers being in ages 25 to 44. Suicide by firearm was much greater than all other means combined. And so, we're not advocating that people be deprived of their firearms, but there is a lot of work being done to make sure that firearms, for a variety of reasons, are kept under lock and key. We read all the time about youngsters finding the gun and shooting themselves or somebody else. We also know that if someone is in the throes of a suicidal ideation, that if there is a means immediately available, they will want to take advantage of it. If that means, meaning a firearm, is not available, very often that moment will pass, and very often there's intervention and it doesn't come back again. We have more suicides in the 55 and older population, particularly, again, white men over age 60. We're seeing increased suicides among our farmers, worsened by increasing debt, extreme weather, uncertain prices, and isolation. There's a very, very helpful resource that can be found at Raising Hope KY. They're doing excellent work in reaching out not only to farmers, but also to young potential farmers through Future Farmers of America and the 4-H clubs and so forth. There really has been tremendous outreach. While LGBTQ youth are not inherently prone to suicide, because they are often the targets of bullying, mistreatment, or stigmatization, they are at higher risk of suicide. And the Trevor Project is an excellent resource. House Bill 48, unfortunately, would reduce the frequency of trainings for school staff to be educated about suicide prevention. Students in public schools in Kentucky still get twice yearly education about suicide prevention, but now the staff will receive less training. Next, please. This is an incredibly valuable resource because it gives you very current information about who is accepting new patients, what beds might be available. You can sort by mental health or by substance use disorder. You can sort by area of the state. You can sort by gender of the person you're seeking treatment for, by means of payment, and so forth. And this is updated almost daily, but certainly weekly, by those treatment agencies. They cannot remain listed at Find Help Now if they're not regularly updating their information. So it's sponsored by a number of organizations that you can see there, but I highly, highly recommend it. Next, please. The 988 Lifeline is 3 years old, or will be 3 years old in mid-July. We're one of the only states in the nation where those calls are answered locally, because they're answered by the community mental health centers across the state. There's less than 20 seconds wait time. Fewer than 2% of the calls are referred to law enforcement. We've added text and chat features. We have dialing options. You can dial 1 immediately if you're a veteran, 2 if you need Spanish, and 3 for LGBTQIA callers. However, Option 3 may be losing its federal funding from the federal government. President Trump and his allies have targeted LGBTQ anythings under DEI, shutting down DEI, but they're probably going to unfund option 3. But remember that the Trevor Project itself is established, it has a lifeline that's 24/7. Next, please. Just a reminder that you need to be careful about how you're feeling. If you're out in the community, if you're listening to a lot of the woes of your fellow Kentuckians, it's very easy to get overwhelmed. And like they say on the airplane, you have to take care of yourself first. So they say if the oxygen mask drops, put it on yourself first and then turn to who you're traveling with, if it's a younger person or an older person that needs help. So look for signs yourself or in those that you love. Certainly if those changes persist for 2 months or more, check with your primary care provider or with a trusted friend or colleague to get some feedback. MHA Kentucky offers confidential online screening that will give you some factual information about how your responses match up to those with a particular diagnosis, would give you some feedback. And we have people that, check in regularly kind of on themselves using these screenings. And basically, when in doubt, reach out for help. It's always better to catch a problem early on before it becomes overwhelming. So thank you very much. And I wish you good mental health. Remember, mental health is health. And I'll turn it over to my colleague, Priscilla. Thank you.
Thank you. Hi, everyone. I'm Priscilla Easterling, and today we're going to cover Medicaid and Marketplace updates. I'm the Director of Outreach and Enrollment for KVH. So as Emily started off, as mentioned earlier, one of the big things that's happening in the Medicaid and Marketplace landscape is Congress considering significant cuts to both Medicaid and the ACA. For Medicaid, that's going to look like, they're talking about, that could look like mandatory work requirements, mandatory copays. Folks who have had Medicaid in the last 5 years, they have not had to pay a copay at all. We know that any copay is a barrier to accessing treatment. Sometimes folks do not have the $30, $40, $45, $50 that it takes to be able to go to a doctor. So having mandatory copays is absolutely would increase barriers to treatment. And we know folks will often, if they have copays, they will delay treatment because they don't have that $30 or $40 today. And delayed treatment can often and usually turns into much more expensive care that might require going to the emergency room. And so it becomes a much more expensive endeavor overall. They're also talking about increasing verification requirements. That's a lot more paperwork, but the system already gets so bogged down with the paperwork that folks have to send in as is. There are so many complaints that we've heard about folks just trying to figure out how to navigate submitting the documents that are already required, and they want to make it more complicated and more difficult to satisfy those requirements. They're also discussing doubled redetermination periods. So instead of once a year, moving it to twice a year, every 6 months, limiting state flexibility and reducing those overall marketplace subsidies within the ACA market. So those premium subsidies that make ACA coverage, that make coverage on Connect affordable for families and individuals, those would be reduced and those premiums would be increased for the exact same coverage, but just way more expensive. Because who doesn't want more expensive healthcare that is also not satisfying their needs at a time when everything else in this economy is so expensive. Next slide, please. So just as a reminder, 1 in 3 Kentuckians use Medicaid for their healthcare. more than 600,000 kids are currently covered by Medicaid, and that includes 1 and 2 with special needs. And this year, 2025, we've had almost 100,000 Kentuckians that initially went through the open enrollment period to get enrolled in the Connect Marketplace. But since then, more folks have been able to access health plans on Connect, and we're over the 100,000 mark for this year so far. So it is a critical support, and it is at risk. Next slide, please. So good reminder for Medicaid, 96% of adults are already working, caregiving, living with a disability or illness, in school or retired. 96% of adults would already qualify for the exemptions that they're discussing and including in these cuts. Although that's not a guarantee because the exemptions can be very difficult to get. And so they're really talking about trying to target about 4% of adults on Medicaid who, they're worried that they're not satisfying that work reporting requirement. But whenever the system is bogged down, when the call center has long wait times, when paperwork when it takes the state a long time to process paperwork, it would impact the entire system across the board. The more paperwork that they have to process, the slower the process is, the more complicated the process is. And so everyone would absolutely be affected by these changes. Next slide, please. And then for children, 46% of all Kentucky children are covered by Medicaid right now. And 94% of eligible kids are in Kentucky are currently enrolled. 51% of Kentucky children under kinship care receive Medicaid. It helps support 86% of schools nationally use Medicaid to help pay for health staff like nurses, therapists, psychologists, and 60% of schools, if they actually made these cuts, 60% of schools could expect cuts to health staff, mental health services, and disability supports. So all of those resources that are in schools and available for children, they are at risk too. And so it's really important to understand that even if you are not currently enrolled in Medicaid, the cuts to Medicaid will impact your community, the people in your life, the children in your life, your neighbors. And it's super important to understand that none of us are going to be exempt from this, from these cuts. Next slide, please. And so we've gone through, as Emily mentioned, we have our Medicaid Defense Coalition. We have some great one-pagers that talk about the impact of these proposed cuts based for all of these different special populations. They're all linked there and in our Kentucky Medicaid Defense Toolkit. Please check it out, download, share any resources, and if you need anything else, please reach out and we would be happy to get any information that would be helpful. Next slide. And I do want to focus on the marketplace piece because Medicaid is super important, but the marketplace is also super important. So at the beginning of this year, we had around 97,000 who enrolled. Again, right now, we're sitting at around 105 who've gone through the process this year. There's always case activity, so that number is going to continue to grow throughout the year. For the biggest piece is that those enhanced marketplace subsidies, the piece that makes health insurance more affordable, those were expanded and enhanced back in 2021 as part of some pandemic policies, and those are currently scheduled to expire at the end of this year, which is a big deal because we're looking at premiums going up by about $200. The average premium currently is around $139, and if those premium tax credits expire, that same plan would go up to $327 a month, and that is so much more to be spending on the exact same plan, and at a time when everything is so much more expensive. And instead of focusing on making these plans more affordable, they're trying to make them more complicated and make it harder for folks to get enrolled in coverage. So just a reminder. Next slide, please. Okay, and so switching over to the state updates, child renewals are getting started at the end of this month. July 1st is when they're back to normal. So those first notices really went out, initial notices went out in May. The first notices that are due for renewal at the end of July, those went out last week. The most important thing is to make sure that contact information is up to date and connect. You can do that by logging into your own self-service portal or calling the call center or reach out to a connector. There are connectors available in all 120 counties, free of charge, who are able to help walk through the entire process with clients. And there's a great explainer both in English and Spanish that is there as well. Next slide. And a reminder, so one thing that we want to make sure that folks understand, the income limits for children is much, much higher. They're much, much higher than it is for adults. So don't assume that just because the adults are not eligible, that the children are not. For example, for a household of 4, the income limit for adults is $44,000. So above $44,000, the adults would not be eligible. But for children, they would be eligible up to $70,000 in the household income. So just keep that in mind. Let the system make that determination for you. When in doubt, just fill it out. The system will make that determination. Don't assume. And if you need help, again, reach out to a connector. Next slide. Your example notices, make sure to check for those in the mail. Next slide. And an important change that is also happening. So previously there was a 90-day reconsideration period. This is one of the flexibilities that is going away at the end of this month. So if folks miss their redetermination window, they're due July 31st and they do not submit their information, they will have to submit a new application. You can go in and update any changes in your account, but you'll need to submit a new application rather than going through that reconsideration period. So just an important note. Yes, there is a great listing of connectors that's available on connect.ky.gov, and I can drop the link in the chat or in the follow-up email. Next slide. Okay, so new news. This just dropped yesterday, and I'll sort of rush through. The DMS and DBHDID are developing a new waiver to serve individuals the age 21 and younger. This waiver will offer 1915C home and community-based services to children, youth, and young adults with multi-system needs, complexities who meet either hospital, psychiatric, residential treatment facility, or intermediate care facility for individuals with intellectual disabilities level of care. That was a mouthful. There, I attached the public notice, the waiver application, and the application summary. So those are all linked right there. So read through those if you'd like some more information. That comment period runs from June 16th through July 15th. So if you're interested, please submit those comments. Let the state know what is important to you and how this program could support you. Once that comment period is over, then they'll review everything, issue a formal public response, and then they'll submit it to CMS for approval. So more information is linked there. And if you have any questions, feel free to reach out to the email there or to me. Next slide. Reminder that the Medicaid monthly virtual forums, our next one is tomorrow. Those are with DMS. They host an ongoing stakeholder engagement meeting. You can register at the link that is included there. Wow. Also, Medicaid is always open for open enrollment. So if you know folks who are uninsured, make sure that they have access to healthcare. Again, reach out to a connector. That's my #1 recommendation. Medicaid, you can always enroll for Marketplace. Open enrollment is November 1 through January 15th, but there are also special enrollment periods, which are on the next slide. We have a great one-pager that goes through all of the special enrollment periods that are available. And again, reach out to a connector if you need help with that. Next slide. And the last thing, I just wanted to perennial consumer alert. As you're working with folks who may or may not have health insurance, make sure that they're being careful about junk plans. There are a lot of plans that are medically underwritten that try and sell themselves as like a good, cheap alternative that'll cover things that you need. But in practice, one, they don't actually, they may or may not actually cover you. They don't actually have to cover any of the things that they say that they cover. In truth, when you get into it, they often don't cover most of the things that they say that they will. So just be careful. There are only 4 qualified health plans that are certified ACA approved. Those are Anthem, CareSource, Passport, and WellCare. But really, you need to go to connect.ky.gov or work with a connector or a Connect insurance agent to be able to enroll in those. And by the way, if you work with a Connect insurance agent, make sure that they are not selling you other products. We haven't heard many cases of that, but there is that concern that they'll have your information and they'll be able to reach out and sell other products unrelated to healthcare. So just keep an eye out. And if you have any questions, don't hesitate to reach out. And with that, I will turn it over to Dr. Schuster.
Just want to thank you all for joining us. Our next event is July 8th when we will be in Henderson. We'd love to see you all in the Henderson area. Our next webinar is with the Cabinet for Health and Family Services on August 19th. Do not forget to fill out the evaluation form, and those who want CEUs absolutely have to fill it out, but we hope that all of you will fill it out. And we've enjoyed being with you today. Thank you very much, and have a safe and healthy rest of the summer.